नमस्कार दोस्तों, I am Dr. G, radiologist यानी कि आपका स्कैनिंग डॉक्टर. In my previous video, I spoke about different types of scans available and how for many patients, for many people, they are just scans and they can be used interchangeable, and that is not the case. Today, let us dive a little deeper into different types of scans and understand the differences between them and also the key factors. Let us start with ultrasound. Ultrasound is a very safe and easily available scanning tool available for most of the patients. Almost it's available everywhere. And it uses sound waves. It has got no radiation and hence it is very safe. It can be utilized in pregnancy. It is used for abdominal scans, thyroid scans, and it can be used for breast scans and scrotal scans. It can be combined with Doppler scan to assess the blood flow, and it is kind of the first scanning tool used in most of the patients. So in essence, ultrasound is easily available, safe, and one of the best tools for pregnancies. Next, we talk about CT scans. CT scan uses radiation, that is, it uses X-rays to generate cross-sectional images of the structures in the body and identify diseases there. CT scan is very fast, rather super fast. Nowadays it's becoming faster and the scan happens within few seconds. It is extremely useful in accidents, emergencies, fractures, internal bleeding. So this is one of the best tools available in acute emergencies. So CT scan is fast, very fast, and extremely good or best for emergencies, that is acute trauma, injuries, road traffic accidents, internal bleeding. However, it has radiation in it and hence it cannot be used in pregnancies, particularly early pregnancies. We talk about MRI. It's not a very fast scan, but it's a very detailed scan. It uses magnetic field and radio frequencies to generate images of different organs in the body. It takes more time, but very detailed images are available. It is very good for brain, spinal cord, joints, muscles, and it is the best modality available for identifying stroke in say less than 1 hour, which is called the golden hour. So MRI is very good for stroke and brain and spine and other structures like joints and bones, joints and muscles. Of course, some of the bone tumors can be identified very well as well. Then we talk about PET-CT scan. Before talking about PET-CT scan, I want to categorize these imaging tools as structural imaging and functional imaging. So CT scan, ultrasound, MRI, all these are images which provide us details about the appearance or the structure of the disease. Whereas PET, positron emission tomography, is a functional imaging tool where it provides details about the functionality of the disease, how it is behaving, what is its activity. When you use PET along with CT and MRI, it's called fusion imaging, which gives best of both worlds. It gives us the functional information about diseases. It also gives us about the structural abnormalities very well. So this functional imaging along with CT and MRI, which is called fusion imaging, is most commonly used in cancer. So for the detection of cancer and staging of cancer, most commonly they are used here. And of course they can be utilized to identify prior heart stroke, or you can call heart attack. So PET-CT scan is a combination of functional imaging and structural imaging. So today we talked about ultrasound, which is very safe and can be utilized repeatedly on patients if it is required. Doesn't cause any harm to any patients, and easily available, used in pregnancies also. CT scan very fast, used in emergencies, trauma, accidents, internal bleeding, and MRI with very detailed evaluation, extremely good for stroke evaluation, and it can be very good for brain, spinal cord, and joints and muscles. PET CT scan is a combination of positron emission tomography and CT scan image, or PET MRI, positron emission imaging, and MRI, combination PET MRI. So these are fusion imaging tools used most commonly for cancer detection, that is diagnosis, and cancer staging, cancer treatment response evaluation. All these things are possible. So दोस्तों, today we spoke about different modalities and their key features and differences, and let us dig deep further into each and every modality as far as their application is concerned and what the Aam Aadmi should know about these techniques and diagnostic tools. If you want to know more about all these imaging tools, please follow me on Vignan with Dr. G. Thank you.